again. So the breathing is so important. When people have allergic rhinitis, they have congestion. They couldn't have enough oxygen. But recently you did some research showing that acupuncture helping to improve the symptoms, comparing the control or comparing the medication they use, right?
And this is not, anyway, my work. The American Academy of Otolaryngology and Head and Neck Surgery, who are, a major governing board, has looked at how effective acupuncture is for patients who have allergic rhinitis. And they find that it improves the quality of life,
Yes.
doesn't have the potential side effects,
Uh-huh.
and it's in a large study. They said multi-center, which means it wasn't just at one place, but many hospitals or groups participated.
Yes.
It found you improved quality of life, greater reduction in the use of medicine.
Yes.
So therefore, and it also showed that you got a more active onset of symptom relief by using acupuncture, especially for the nasal congestion and the sleep disturbance that some people get. If you're stuffed up at night,
Yes.
it's awfully hard.
Yes.
And that the treatment protocols in this particular study, 8 to 12 sessions over 4 to 8 weeks.
Yes.
So it's not a huge number of sessions.
Yeah.
And
It's 2-3 times a week, right?
yeah,
Yes. So
So-
it's more frequent.
yes. It was interesting because I don't know enough about acupuncture, but what they say is how it may work. And they think it affects our immune response,
Yes. The anti-inflammatory.
right? It reduces something called IgE
Yes.
in the blood,
Yes.
and it decreases our inflammatory cells.
Yes.
So it's, and therefore it's felt to be a safe and initially you may want to start it, if you're having this problem with medicine, you may be able to drop the medicine.
Yes.
And there is no side effect free medicine.
Yes, and my personal experience is when people have nasal congestion, either allergic rhinitis or sinusitis, if they continue to use the cortisone or different ephedrine to constrict the blood vessel to reduce the congestion, initially it's working well, but then over the time it becomes so dry, and so it irritates the sinus.
And for the people who use these, you almost get yourself into a situation where you have to keep using them.
Yes.
Because you think you're getting a little bit better after using the spray, but then in a little while you get your return to your symptoms. So use it again
Yes.
and again, and it just cycles.
That's
And
right.
these medicines are over the counter. So there's no way that somebody's taking the time to educate you about there are safer alternatives, because you
Yes.
walk into wherever you purchase your pharmacy and you can get them. And yes, they are safe, but they're not meant to be used on and on and on. And depending where you live and the climate, some people have year-round problems. Some people it's only during a season or two. But in any case, if the patient would try acupuncture, the effect lasts beyond the end of the acupuncture treatment.
Yes. Yes.
And indeed, some of the studies show it may last longer
Yes. After you stop.
after you
acupuncture.
stop her than
Yeah.
if you take a pill.
Yes. Yes.
So you're getting the benefit of a basically totally benign treatment, not putting a medication into your body. You're sleeping better, you're feeling better, you're not as congested. So it's a win-win situation.
Yes, and also there is a protocol from the American Otolaryngology Society.
Yeah.
They said it's like 2-3 times a week for 24 treatment.
Right.
Yeah.
And although that's not a lot, because if you start taking medicine and you look at how much medicine you're going to take over a period of time, and people are taking that medicine every day.
Yes. Yes.
And indeed, I mean, I've had people who've taken it, but then they find, gee, I'm very sleepy when I take it, so I can't take it and I have to suffer.
Yes.
as a side effect, or getting nausea, or any one of the other numerous side effects of these over-the-counter medicines. Much safer to use acupuncture. The only side effect for acupuncture is, as we discussed in the past, maybe a little bruising,
Yes.
and that's it.
Yes. Yeah, but it's also the effort. You have to really spend the time and money to. Now, actually, Blue Cross Blue Shield started covering acupuncture, but they restrict it just for pain, like
Okay.
migraine, neck pain, back pain. They haven't expanded to other symptoms.
But it's like many things, at least they're looking and they're open to it.
Yes.
And if you start looking at costs, it's much less expensive than going through a procedure.
Yes.
Some of our new medicines are extraordinarily expensive.
Exactly.
So if you can help somebody with a number of sessions of acupuncture, but it's, in many things, sometimes it's just easier to say, well, I'll just take a pill or use a nasal spray. You're not necessarily helping yourself more.
Yes.
But it's not all. Most places for acupuncture, and I know you're included, are very flexible, so people can get in and get the treatment they need.
Yes, especially now, the physicians are so busy, and especially the younger physician, they don't like to see patients. So there's a long, I heard like cardiologists, some patient has to wait for 2-3 months. But I was thinking Blue Cross Blue Shield started covering that, giving like 12 treatments. Some plan give like 20 or unlimited. So if somebody else pay for that and people is willing to try, and once they get benefits, then they will. That,
and then reporting it back, back to the providers to say, hey, I'm better, and it didn't cost you a fortune for something else.
Exactly. Yes. So.
Yeah. But it is acupuncture is a field that I'm still learning a lot about. I know very little about, but the indications, because I was trained traditionally, I don't think in medical school I heard about acupuncture, and this goes back many, many years ago. I mean, it was there. And then I remember when a colleague of mine went to China on a medical mission, and he came back so impressed because he saw major surgery with anesthesia by acupuncture.
Yes.
And that was so foreign to say that here is a alternative. But like many things we like to think of, what we have is the only answer, and don't want to go outside and look at, well, there are other options, and Chinese medicine has been around for 3,000 plus years, and it's a wonderful field which has evolved and treats this, people have allergic rhinitis in China as they do here in the States.
Yes.
Or headaches or whatever it is. So it's worthwhile. And the costs are not exorbitant.